I've been working on platelets, thrombocytes, another word for it, for many, many years as a tool to study signaling, receptors, pharmacology, and diseases. And in particular to study those receptors and pharmacology which inhibit platelets, which is very essential for many diseases nowadays to prevent myocardial infarction and stroke and so forth. And this is a very nice topic, it's very important. It's also still very important in terms of pharmacology, biochemistry, and we still discover every year something new. Not we alone, but many others. The clinical implications is, although it's pretty much understood that platelets are very important for diseases, stroke, myocardial infarction, and are very detrimental sometimes, they're still, and we can treat them quite well. There are still many things to learn, also in the long-term diseases, like inflammation and other ones. And therapy also has to be safe and not side effects and so forth. There are many things to study. The main challenge of the field of this Congress is thrombosis and hemostasis. So it's bleeding disorders and it's also stroke and other ones. And there are always challenges because the people change, they become older, and other ones we discover new genetic contributions and so forth. So you have to always improve your current therapy, and I think our work also will contribute to that. I think it's very important, it's even essential, because in our field you do not work alone in your private practice or in your laboratory or in your something else on the computer, because you always need numbers and patients, and they have to be valid. And let's say, one simple example, you have to treat 10 patients well, then you know it's a very good chance to go on with that. And that you only can do with networking. And I'm personally also interested in what's called rare diseases. And they are very important, you learn something, but these people need to be discovered and treated. And you do not have them always everywhere. You know, you have to find them with your colleagues in Switzerland and other places, and it's very important. In my own career, it was very important that I was lucky to be with excellent professors and groups in America, but also in Germany, and both in basic science and in clinical science. And that has helped a lot. So, and of course, you have to also see different views, different people, different groups, different countries, different way of doing things. So I always advise to be open, to go to other places, other countries, other languages, and see that, but have a sort of kind of goal in mind. Where do you want to go with your career, and whether you want to become a physician or a research scientist or something in between. That's very important.